Seconds to go. Start. Test, treat, and track has been a strategy successfully employed for COVID. We need to aggressively scale up testing with innovative strategies such as active surveillance, bidirectional screening for respiratory tract infections using the most sensitive molecular diagnostics and contact tracing. The biggest victory against COVID has been the speed with which vaccines were developed, scaled up, and deployed. We need to replicate the same for tuberculosis, lobbying for funding from governments and industry to develop a successful vaccine for TB. Malnutrition, poverty, and immunocompromising conditions such as diabetes are some of the factors strongly associated with TB. Over 100 million Indians smoke tobacco, a strong risk factor for both developing TB and dying from it. Social security programs that work towards prevention of modifiable risk factors would possibly pay richer dividends than an exclusive focus on medicalizing the disease. Environmental factors which have been neglected include ventilation of indoor spaces, educating individuals to avoid crowds when possible, and to encourage voluntary masking, especially in ill ventilated and closed spaces. We must not lose this opportunity to invest in these measures at a time when the sensitization to their need is high. COVID has been a stellar example of how investments and actions can be swift and public education can transform behavior. Similar aspirations for TB can help turn this crisis into an opportunity to reimagine our overburdened and underfunded systems. We need to actively engage the private sector, build bridges and partnerships as we did in the case of COVID. All this, however, is easier said than done. India needs to triple the funding not just for TB but for health, nutrition, and preventive services. The country needs to invest in state of the art technologies, build capacity, expand its health workforce, and strengthen its primary care facilities. It also needs to consider telemedicine and remote support as important aspects of health services. Most importantly, before embarking on any of this, it needs to build an open and collaborative forum where all stakeholders, especially affected communities and independent experts, take a lead role. We have ignored TB for too long. It is a time we acknowledge the magnitude of the disease and work harder at offering individuals equitable health care access and resources that the disease warrants. Stop.